19 months into a pandemic that's killed more than 700,000 people in this country, and rapid tests that have been around since month 2 are somehow still hard to come by. That's why the White House announced today that the FDA is streamlining its process to authorize rapid tests, to make at-home testing kits more available and cheaper. Vaccine progress is coming fast and furious, though, with booster shots more widely available, and the FDA meeting tomorrow to discuss whether to approve Pfizer's vaccine for kids as young as 5, which could be available as early as next week. Moderna also released some interim data today, which they say shows their vaccine is even more effective at protecting from moderate to severe COVID among kids 6 to 11 than it is for adults. So I have to admit, as cynical as I often am about these things, I actually find myself feeling a little hopeful today. And adding to that are 2 places in Massachusetts that have become models for the way they've managed to turn things around, as was recently highlighted in 2 great stories in the Boston Globe. As I'm sure you remember, Chelsea became a hotspot for COVID-19 spread early in the pandemic, and by the end of last year, the city was averaging more than 100 cases a day, double that of Boston, which has more than 18 times its population. Fast forward to today, Chelsea is one of the most vaccinated places in the country, with nearly 3/4 of people there having been inoculated. And then there's Provincetown, which made national headlines over the summer when a cluster of more than 1,000 cases prompted an emergency return to some COVID restrictions, like mask mandates there. And those actions are being credited in a new study from stopping Provincetown from becoming the next Biogen. So how can we learn from these 2 success stories? Joining me are the town manager of Provincetown, Alex Morse, and Gladys Vega. Gladys, the executive director of Colaborativa. It's a nonprofit community organization in Chelsea. It's played a major role in the city's COVID response. She and her organization, you may remember, were named among the Boston Globe's 2020 Bostonians of the Year. Gladys, Alex, thank you both so much for being here. I appreciate it.
Thank you for having us.
So, Alex, starting with you, why did Provincetown not become a super spreader?
Yeah, it certainly had the potential to be one. I think first and foremost, we deployed adequate testing and abundant testing as quickly as we possibly could. And so we had a mobile testing unit here in Provincetown within a few days of the indication that we were having an uptick in cases. And thousands of people throughout the course of several weeks utilized that testing mechanism. We have a very test-conscious, health-conscious community, both of our year-round residents, but also the visitors here over the summer. We also work with our business community and launched a voluntary certification program where businesses had signs that attested to the fact that all of their employees were vaccinated and that they required vaccination for entry for their customers. And so I think those quick actions, and then of course implementing the indoor mask mandate in the short term was also effective. And I think I said at the time that going to an indoor mask mandate and then relaxing it constantly isn't really our way out of this. But in a time of a spike or an outbreak, it's important we do that in the short term because vaccination is really our way out of this. We lifted our indoor mask mandate on before Labor Day weekend, and we haven't had to reinstitute it since. And ever since we had that quick action, we've been on a steady decline.
So Gladys, let's go to Chelsea. As I said, one of the highest infection rates in the country to one of the highest vaccination rates in the country. How'd that happen?
So I think the way that it happened, first we identify a key partner. They knew the neighborhood of Chelsea. So we are their community nonprofit trusting agent, but we needed a hospital that was trusted in the community. So we brought our friends from East Boston Neighborhood Health Center to open a clinic in our office. We gave our office up so that office that everyone trusts right on the middle of the city on Broadway, that became the vaccination center. But from there, we didn't wait for people to come and choose to get vaccinated or making appointments. We went door to door with doctors from Children's Hospital, from MGH, with neighbors, pairing them up. So when they're at the door and a person says, and they knock, and the person says, no, I'm afraid, I'd rather wait. We are like, listen, we have a doctor right here. She's able to address any concern that you may have, and we would do it in Spanish. So if we had to translate, most of the doctors knew Spanish, but if we had to translate, the person from Chelsea, the resident of Chelsea, was right there doing the translation. But we also use that door knocking to provide wraparound service. So when a person was hesitant and would tell us, I am not interested right now, we will talk about the food pantry. Please stop by, pick up your box of food. How is your housing situation? How can we help? And then 2 weeks after, we would put that and we would immediately register that person like she's not interested. And 2 weeks after, we would send someone else to do wraparound services and ask her how is she doing again, and then engage her in the conversation. And what happened is that we earned their trust. We provided some essential services, and they're like, you know what? I'm vaccinated. And these people have tried so hard to get me into this vaccination opportunity. And we had a card. Excuses, there were none. For every excuse you gave us, we had the answer. We would have the car outside and drive you to the vaccination center. So, I mean, for us, it was easy to be with. At the beginning, we began with 15 people knocking on doors, and then we paired them up with doctors. So it was, sincerely, for us, it was easy to convince them because we had all the expertise and all the resources there.
Well, we know you don't take no for an answer, Gladys, that's for sure. But Alex, back to Provincetown, was there resistance? I mean, I was in Provincetown right about that time, and I heard a little grumbling from some small business owners, but not much. Was there basically a buy-in early? And if there was, how'd you pull that off?
Well, there was some initial grumbling, and part of my job at the time was to make sure that we didn't overreact, that we followed the science and we followed the data. And what it was suggesting at the time is that we implement the indoor mask mandate. And that was, I think, the least intrusive move we can do to impact what, in many standards, is, businesses that rely on a tourism economy throughout the summer. We knew people had a tough 2020. In an okay fall of 2020, but this was supposed to be the summer where a lot of businesses had their comeback and did the best they ever did. At the end of the summer, we're starting to do an autopsy, and over 70% of our businesses report that their business was average or above average, which was a good indicator that despite the COVID cluster in July, businesses still did well. By engaging them in the voluntary certification program with the Board of Health, and to celebrate, like, hey, we want people to come here, we're safe, we have the mask mandate, our employees are vaccinated, every other customer or client here is vaccinated. That slowly got people back to town. So we had a very successful August. We're having a very successful fall and encouraging people to enjoy, all the outdoor fall activities that we have.
By the way, for Provincetown, for those who didn't follow closely, use the term autopsy. There was no need for a literal autopsy, which I think is a credit to the work you did. Alex, staying with you for 1 second, did the state play a role at all in this, or was this purely within the borders of the community?
I will say the State Department of Public Health was a great partner. I will also say that the Barnstable County Department of Health and Environment was also an essential partner. This was a real team effort. We were on daily morning calls going over test results. We also distributed boxes and boxes of rapid tests to every business owner in town, as many as they needed to do early detection. And so this was a real team effort from residents to town employees to the county to the Department of Public Health, all the way up to the CDC, really. And I think it was a testament and became a model for other communities as to how to detect early, test, treat, and really do your best to mitigate the spread.
Speaking of, and back to Chelsea, Gladys, I know the vaccine equity initiative that the governor started, I think $30-some million to 20 targeted communities, $2 million to Chelsea, I think 50-some thousand to your organization. I assume that was pretty pivotal, no?
Yes, of course. And I think that the partnerships also, when we had minimal resources, we pair up with great hospitals, local people that help us put this whole movement together where people literally could not say no. Also, I have to explain that whenever we found out that there was an age category or the males that were 25 to 35 did not believe in vaccination, we did a special effort going where they usually hang around or where they live or whatever. If they were in an apartment with other roommates, we will go to the house with the resources necessary to get them to vaccinate. So, of course, the attention of the governor, the attention of other key players within the two hospitals that we have here, the support that we got from the state was necessary. But what made it happen was for us to go door to door. The people that we hire are people that are connected in the community.
Understood.
The churchgoer, the young person that is in the football teams, etc. We make sure that we identify key people to do the door knocking so that you couldn't say no. And we would bring the sad part. Like if you want to be able to have, like the emotional part, like if you want to be able to hug someone and see your grandmother, please vaccinate for her and believe that you can make a difference.
You know, I only have a minute left if I can, but Gladys, starting with you, the Chelsea model seems to be so perfect, but there are other communities not dissimilar from Chelsea. Take Springfield, for example. A huge person of color population, relatively low income, that has not followed your model. Are other communities in the state reaching out, looking for guidance from what you did or no?
Yes, of course. Today we had 4 different cities and towns, including Lawrence, asking us to meet with them to figure out this whole style that we have used in terms of going door to door and providing wraparound services around vaccination. And
Alex, for you, what's the moral of Provincetown's story for other communities that suffer at least similar kinds of fates?
Well, first, I want to commend Gladys and everyone in Chelsea for their efforts. I think it's a great model, meeting people where they're at. And here in Provincetown, I think it's listening to the science, following the data, and reacting accordingly. But it's finding that sweet spot because some people were very eager to overreact, and we had to demonstrate the power of vaccines. To think over 1,000 cases associated with a cluster, only 7 hospitalizations, and as you pointed out, 0 deaths. If anything, the vaccine works, encouraging people to get their booster shot. And when there are times of an uptick, respond accordingly in the short term to have a more sustainable and healthy long term.
Congratulations, Alex and Gladys, to you and to all the people you're working with. 2 wonderful stories out of a nightmarish year. Thanks so much for your time. I appreciate it.
Thank you.
Thank you. Gracias.
Thank you.